All right. Hello, folks, and welcome. I'm Stephanie Spencer with Natural State of Health Plant-Based Wellness. I'm a former cardiac RN turned plant-based educator. I'm board certified in lifestyle medicine, and I love sharing with people the healing power of plants to prevent, treat, and even reverse chronic disease. And so I'm pleased today to be joined by Paul Chatwin. Paul learned about the option of plant-based nutrition to reverse his heart disease literally as he was about to go into the operating room with 3 blocked arteries. And Paul shows that you can not only survive survive heart disease, but thrive on a whole food plant-based diet. Paul went on to found Plant-Based Nutrition Support Group in Michigan in 2014. And he did that to spread the word about the promise of plant-based nutrition to reverse chronic disease that most often sicken and kill us. So PBNSG now boasts more than 8,000 members. And additionally, Paul has spoken publicly to share his story at numerous locations, including 14 General Motors facilities and 20 Beaumont Hospital campuses in Michigan. PBNSG also partnered with Wayne State University to teach medical students about the promise of plant-based nutrition in reversing chronic disease, which is a pretty big freaking deal. So today we're going to hear Paul's personal story, and then we're going to discuss, and I'm going to use a whiteboard and some fun little icons. We're going to talk about the importance of dietary patterns to promote health, as opposed to our typical focus, which is on reductionistic medications, procedures, or supplements. So that's what I want you to understand, is this is the overall picture of what we're eating, not just like a single beta carotene pill that's going to make the difference for you. But first, I want to tell you about an exciting opportunity that Paul and I are both a part of. And this is Chef AJ's Ultimate Vegan Health and Weight Loss Bundle. And for those of you that are not always online, you may be asking, what is a bundle? And a bundle is basically a collection of digital creations from this bundle has over like 110, I think it's almost 100 contributors. And I think there's over 110 contributions to the bundle. So these are all basically electronic resources. Lots of them are recipe ebooks. Some of those recipes, these ebooks have like 100 recipes in them. Some of them are courses from like well-known doctors. Some of them are plant-based cooking courses. There's all sorts of resources. And so if you click the show notes below, there's a link that will take you to the list of all the resources in the bundle, and then you can also purchase there. So, yeah, Paul, I want to thank you for joining me today. Before we get started with my little demo, why don't you say hi to everyone and then tell us what Plant-Based Nutrition Support Group is contributing to the $49 bundle.
I want to welcome everybody, and the PBNSG organization is going to be adding to the bundle a lecture from Dr. Alan Goldhammer, and Dr. Joel Furman. So those are two. And then we're also going to include our perfectly plant-based cookbook on, e-form. And what I would say about that, it's about 112 recipes from 33 chefs. And the thing I'm most proud of is not only do they taste fantastic, but they're all no oil.
Perfect. Yeah. And that's an important thing. No oil is really important if your goal is chronic disease reversal. So yeah, that is excellent. So, and I'll tell you real quick, my contribution to the bundle is my plant-based jumpstart course. And this is everything you need to get started on a plant-based diet. This will take you from knowing absolutely nothing to knowing how to shop, what food patterns you need to follow, how much of every serving you need to get every week. It also includes like a lab worksheet. My course is really good for integrating plant-based nutrition into your non-plant-based family practice physician's visit, okay? Because lots of times people get really nervous. They go to their doctor who's gonna look at you over their glasses and say, well, where are you gonna get your protein? And so I also have printable resources for your physician that you can hand them that shows them that this is all based on research. It's from the American College of Lifestyle Medicine. It even has like continuing medical education credits that the physician can get in plant-based nutrition. So it just is going to kind of show them that this is a real thing and not just something you found on the internet, right? So yeah, it's a really excellent resource, and I'm very proud of it. So we're going to go ahead and talk about this concept of dietary patterns, and kind of like as it follows Paul's personal trajectory, which I think is a really interesting story. So I want to start off, and let me scoot over because I am going to use my whiteboard. I got to make sure I've got room here. I think we can see that. Okay, yes. Okay, I've got to get this opposite mirror effect here. Okay, so we're going to start off with the standard American diet, which the acronym is SAD, and it is really sad once we start to dissect it. But the standard American diet is really just a reflection for those of us, and most everyone has eaten the standard. I mean, like there's very few of us that were born whole food plant-based, maybe a couple people out in California, but the vast majority of everyone just grew up eating the standard American diet. And this is just a reflection of the food environment that we live in. And in the year 2022, most of our food is hyper processed, hyper industrialized, and then we might eat like a few little vegetables on the side out of a sense of obligation, but it's really not a diet that promotes health. And so what I want to do is, Paul, I want you to tell us the story of back in your 30s when you were eating a standard American diet, as most of us all were in our 30s. Tell us what you typically ate and like what your lifestyle was like back then.
Probably prior to 30, I would eat just about everything. And I would say I was strong in the areas of meat and dairy. I had gotten out of college at 20. My first job was Land O'Lakes Butter Company. So there was 5 pounds of cheese that I would get every Friday, and they'd be gone by Monday. Extra sharp cheddar was my favorite. And then after a year and a half of that, I worked for Stouffer Food Company for 5 years.
Oh my
So
God.
we were, I don't think I bought a dinner in 5 years. I would just have their French bread pizzas, whatever their foods were. I was bringing them home, eating them 4 or 5 times a week because I didn't have to cook. But my family and my life was centered around food. And we'd wake up going, okay, what are we going to have for lunch and dinner? And then it was, oh, let's have the Grand Slam breakfast, or, ooh, let's go to this corned beef place. So truly, I mean, in my idea of a healthy meal would be a salad with cheese in it and some oil type dressing of some kind, or ranch, like whoever invented ranch. Woo. So
Yeah.
that was my life. And I didn't even think about anything on the health side because I was still a workoutaholic. I always worked out my whole life. So I always thought, hey, it's okay to eat this way because I will just keep working out.
Yep.
So that's what I was like.
All right. Well, and that's true. And a lot of people do think that, if you're exercising, you don't like the exercise will take care of it and will make you heart attack proof. But there's a reason that they always have ambulances at the marathons, right? Like people always have heart attacks. So, yeah. So what we're going to talk about is the dietary pattern of a standard American diet. And look at this. My daughter-in-law is a graphic designer, and I've got these cute little icons. So we're going to talk about what it's high in and what a standard American diet is low in. So Paul was talking about like getting 5 pounds of cheese and the Stouffer's, French bread pizza. This is a lot of fat that we're going to get in the standard American diet. Okay. And when we talk about the range of fat in like a human diet, like kind of the diets that we talk about, it goes basically from 10% to about 30% of caloric intake and fat. So most standard American diets are 30% fat. But if you're eat like a lot of crap, then you might be up to 35, even 40% fat. That's a pretty bad diet. Standard American diet is high in inflammation. Okay. And this might not be clear to a lot of people, but just meat is inflammatory, and dairy is very inflammatory in and of itself. Dairy, like the cows are milked, and there's pus that gets into the milk. That's inflammatory. The milk also has a lot of estrogen, which is cancer promoting compounds. Meat, all complete animal protein, also has high amounts of this thing called insulin-like growth factor 1. Okay. IGF-1 is a hormone that basically feeds cancer. And the way that it feeds cancer is that it makes your body want to grow lots of blood vessels. And those blood vessels will find any mutated cancer cells you might have in your body and then they'll grow, grow, grow. Dr. William Lee is a Harvard cancer researcher, and he says if a cancer cell does not get a blood supply, it'll never grow larger than 1 to 2 millimeters. So we want to eat a dietary pattern that doesn't encourage cancer cells to grow with a healthy blood supply. So that's what IGF-1 does. Then we also have this thing called TMAO, okay? TMAO is called trimethylamine oxide. You don't need to worry about that. But TMAO is just basically another inflammatory compound that comes from animal protein. And even if you take all of the fat out of like milk and cheese, if you have non-fat milk and non-fat yogurt, it's the carnitine and choline that's intrinsic to animal protein that promotes this TMAO reaction. Basically, the carnitine and choline will combine with the gut bacteria of omnivores, of meat eaters, and it'll make inflammatory compounds, which just trash your coronary arteries and set you up for a high incidence of heart attacks and strokes. So a standard American diet like Paul was eating is high in all of these. What is it low in? It's low in fiber. Okay, there's my little wheat sheath. But yeah, the fiber is going to be very low in a standard American diet. We want to aim for, well, the recommendation is 25 to 35 grams of fiber a day. Most Americans only get about 15 grams of fiber a day. But like if you're eating like TV dinners, a bunch of meat and cheese, and then you just have like a little bit of iceberg lettuce, like I've had some students that calculate their fiber and they're like, oh, I'm only getting 8 grams a day. This is very bad for your health. And we're going to talk later about why fiber is so important. Another thing that the standard American diet is low in is this little sprout is phytonutrients. Okay. That just means plant nutrients, but our bodies require phytonutrients to thrive because as we evolved over millions of years, or hundreds of thousands of years, whatever, we always ate a lot of natural food. And so our body always assumed that it will always be getting plenty of phytonutrients and antioxidants. So our body doesn't make any of its own phytonutrients or antioxidants because, like I said, our body has always assumed we'll always be getting this from food. And then in the last 100 years, we just hyper-industrialized our diet. And so we don't get that anymore. And our body has no idea what to do without these necessary compounds, antioxidants, phytonutrients, and fiber. Okay, so now, Paul, I want you to tell us about your come to Jesus moment when you found out that this standard American diet was not working out for you.
I was probably in my mid-30s. I went to my doctor and we did the usual blood work, and he came back to tell me that my cholesterol was 347. And I said, well, what's normal? He said, well, I'd like to see it under 200.
Yeah.
So what are you going to do about it? He goes, well, we're going to put you on a statin right now. So he put me on Zocor. Unfortunately, after about a month, I got the side effects, which is a high muscle enzyme, and I went from walking to barely walking. I got off of it in about 2 days. I was somewhat normal again. And then he put me on Lipitor because back, 30 years ago, they only had three statin choices. So they put me on Lipitor, and that worked for about 7 months. Same situation. He had to pull me off of that. So then he put me on pravastatin, and I was on 80 milligrams, which is the highest dosage. And my cholesterol did drop, but it baselined at about 280. So his suggestion then was, well, start eating like non-dairy cheeses or skim milk, or, don't have 3-4 eggs a day, have 1 or 2 and make them white. So he was making some changes. I'm not sure if he even knew. But the combination set in motion for what was going to happen 25 years later.
Okay. So tell me, like, what were actual food? This what Paul's doctor recommended is what I call the chicken salmon diet. And that's what we recommended for, like my entire adult life. I was like, switch to skim milk, like that's what I told my patients to do too. And yeah, it doesn't usually work. So tell us like exactly what, once you like were counseled on the chicken salmon diet or the whatever lower fat diet, what did you typically eat at that time?
Well, I did reduce the amount of true beef I was eating, and I started eating fish. lot more fish, and would go into more of the chicken breast world as opposed to the whole chicken. But this is something where I did it for a while. I figured, hey, I'm on medication, so I'm not going to stick terribly to the chicken salmon diet, because I would always go out to dinner and I was traveling a lot. So, eating poor meals was part of it. So I would say that I did try when I was home to kind of curb what I was eating, but it was it was a daunting task on a daily basis.
Yeah. Okay. And that's the problem. And it's true. Like a lot of people are just not compliant with our chicken salmon diet because it doesn't make that much of a difference. And they want to be eating the barbecue anyway. So they're like, why should I bother? So let's think it through. If we're eating instead of beef, if we're eating chicken and salmon, is our IGF-1 level going to just plummet? No. We have high IGF-1 levels that your body makes. Your liver will kick out high amounts of insulin-like growth factor 1 whenever you eat any kind of animal protein. Okay. It's the amino acid configuration of animal protein that makes your body want to make high IGF-1. So when you switch from beef to chicken, it doesn't affect this at all. It's not going to lower your IGF-1. Guess what? It's also not going to lower your TMAO, because all beef and chicken, or all chicken, all salmon, even low fat dairy has high levels of TMAO. You're still going to be making just as much TMAO. And to be clear, even in like Dr. Esselstyn and Dr. Ornish's early diets on heart disease, they did lifestyle studies on heart disease. And like they're kind of famous now for their strict whole food plant-based diet and the amazing results they get. But back in the 80s, we didn't have this TMAO research. This has only been around for about 10 years. And so prior to learning about the effects of TMAO, what we used to always counsel people is to do low-fat dairy, like Paul got, right? So we would tell people, just do skim milk. And so if you compare Ornish's early studies with his later studies, when he said, no, cut all the animal protein out, we get way better results with a zero animal protein diet than we do with a non-fat milk, non-fat yogurt type of diet. Okay. Because even though you take the fat out, you still have the TMAO. Okay. And TMAO is that thing that trashes coronary arteries and leaves you at higher risk for stroke. Okay. So that's not going to help the TMAO at all. Do you have less inflammation on a chicken salmon diet? Well, if you go from like 1 salad a day to 2 salads a day, you might have slightly less inflammation, but you're still eating inflammatory food. You're still eating the milk and the salmon and all that. And is your fat lower? Well, it might be a tiny bit lower. Like instead of having maybe, 34% fat in your diet, you might be down to 27% fat. Okay. And they do lots of studies, like even on diabetes reversal, with like, they'll call it a low fat diet, and it's a 27% fat diet. And nothing changes. And they'll be like, low fat diets don't work. 27% is not low fat. That is an underdosed study. Okay. So we can't call a diet truly low fat until it approaches like 10 to 15% when we're trying to reverse chronic disease. Okay. So this is just not enough of a change to make any difference. And then, so Paul, you're like, basically what, like your doctor may say, like, even do a Mediterranean diet, but like what people hear is, I get to have salmon and olive oil or something, like it probably wasn't clear to you to eat like whole grains, right? Did you switch from like white bread to whole wheat bread?
No, that was never brought up. But the thing that I was going to add is when I made those switches, what I realized is that diet food, the skim milk and the diet cheese, they tasted terrible. Like, so like I just didn't enjoy eating them at all. Right. And even when I would, there's not much greatness to iceberg lettuce, but the fact is that whatever, if I had 2 salads a day, I was still having a lot of salad dressing on top of it.
Right. Yeah. You're still getting all that oil. So like, right. If we're still getting oil or ranch, which is like ranch, like the healthiest thing I could ever get my patients to do was like have them wrap their heads around a balsamic vinaigrette. Because like in Arkansas, ranch is number 1. That's all they eat. So, yeah. So anyway, So your fiber is still going to be low, okay, on a chicken salmon diet. Your phytonutrients, maybe you get like 3% more because you're having 2 iceberg salads a day, right? And then you're not, I mean, like you might get, as your phytonutrients go up, you might get a slightly more antioxidants, but it is not enough to change the trajectory of what is looking like you're going to have severe coronary artery disease, okay, which is leading to the #1 cause of death. So this is basically not taking this disease process very seriously when we say switch to a chicken salmon diet. So tell us what happened next, Paul. You did the chicken salmon diet for what, 20 years, and then what happened?
Right. And then I think it was at 54 years old, I was in a meeting and I started sweating. I got up and I literally couldn't take 7 steps without severe chest pains. And, after a little bit of time, they went away and I got home, and then they would welcome me every single morning and at night for the next 2 to 3 months. Cause I kept that
So 2 to 3 months.
yeah, I did. I should have done something like upfront early, but when it would go away, I'd be able to spend the rest of the day in a normal way. And then,
Yeah.
so I started like not sleeping well because I knew when I'd wake up, I'd feel this way. And finally, I went to see my doctor and he heard a heart murmur that he had not heard and immediately sent me to the local cardiologist that he recommended. And they did all the tests up to a heart catheter, heart biopsy, and that was scheduled like 2 weeks later. And at that time, the doctor, I'll never forget, he said, I've been doing this for about 35 years, and I'm going to tell you, you're probably going to need immediate bypass surgery or a heart transplant. This is my experience. And that's when things started to change, because then I had to confront my wife, who I was trying to spare, my pain.
Well,
And
you didn't tell your wife you were having a chest pain. Well, right, because
I
she would
didn't
have
say
sent
it
you
was a
right
good
in.
move. Okay.
Uh-huh.
I didn't want to worry her. And I thought, listen, I didn't know what I didn't know. Like I didn't know, I didn't have the internet and I wasn't going to go to the library and look up, coronary heart disease. I kept on thinking, well, every day it gets better. So one day it just will go away. No,
Oh.
it didn't. It just got worse and worse. So, I talked to her and then, got her boss involved because tears were flowing between us both. And he's the one who got me into the Cleveland Clinic the day before I was supposed to have my heart catheter at the local hospital.
Oh, okay.
And then the miracles started dropping because then I, had a heart catheter done and they discovered a 100% block in my right artery,
Mm-hmm.
2 other arteries at about 70% blockage. But then I found out I had a leaky valve, enlarged heart,
Mm-hmm.
scarsidosis of the aorta. I had a left bundle block. I had a heart murmur. So I was a real mess. But here I am on the gurney, and again, never met my doctor until that morning of, and I'm all prepped for surgery. He says, "Hey, good news is you don't need a transplant." And his position at the hospital was he was head of transplant surgery for Cleveland Clinic. So
Yeah.
that's what they thought based on the records that they received from Michigan's doctors. And then he said, "But you need bypass surgery," and I was all prepped up, ready to go, and right there at the gurney, on the gurney at the door. And I had made some promises. Everyone's done this where they say, God, if you get me out of this situation, I promise I'll give something back. And I made
Mm-hmm.
that promise. And sure enough, I'm right at the door. He says, "Hey, I've only offered this to one other person in 20 years, but would you be willing to make a lifestyle change?" Now,
Wow.
I had no idea what that meant. Okay. Like to me, 54 is like make a lifestyle change. Okay. What does that mean? But yes, I'll do anything.
Yeah.
All of a sudden he picks up his cell phone. It's like 9:30 at night. He calls Dr. Esselstyn. It turns out his mentor in med school was Dr. Esselstyn.
Oh my.
And Dr. Esselstyn says, "Hey, just go on home and then I'll give you a call in the morning." I'm like, cool. No, no surgery. Great. I'll just drive home. And I got home at 8 o'clock in the morning. He calls me and I got his book within 24 hours, How to Reverse Prevent Heart Disease. I read it end to end. It's not a big book. And that's the life changer moment, because then it was, now I got to take all the food that I grew up loving and gave that away. And then went to a couple grocery stores, started label reading, which was imperative. Shocking how much bad stuff is in the food that you eat.
Mm-hmm.
And, but I will say to everybody, the one thing that I guess my biggest takeaway is I grew up not really liking vegetables and fruit. I just, why? When you could have pizza for breakfast or something, like why bother, right? But I said to myself, I could do anything for 14 days, kind of like your jump start. I
Yeah.
could do anything for 14 days. So I said, okay, no matter what, I'm going to just buy the book. And what was amazing was after 14 days, I lost about 15 pounds. My cholesterol started dropping. The angina went away. And most importantly, I didn't hate the beans, the spinach. I didn't hate the food. Now, in all truth to everybody out there, I don't love it. I don't love it, but I don't hate it. And that was a big move for me because I didn't like it growing up. So I just kept on feeding myself with the fruits, vegetables, beans, and whole grains and started getting healthier and healthier and, got to lose about 65 pounds, kept it off. And I created the PBNSG model as my give back to the world.
Excellent. Oh my goodness. And okay, so I'm obligated to do this as a cardiac nurse, 27 years, worked in a cardiac specialty hospital. I'm just going to do this PSA. Any of you, if you ever have chest pain, do not do what Paul did and hide it for 2 months. Never, never, never. I've had patients, they'll have a heart attack at home and you can have a heart attack and try to walk it off. And then they'll admit to the hospital 2 weeks later and they're in acute heart failure because the heart attack, they infarcted and then part of their heart muscle died. Paul luckily avoided that, but you never know if you have chest pain. You have to go to the ER. Okay.
And let me add to that, like it was to anybody who's questioning, well, maybe it's gas or maybe it's something. No, you'll know. You will know. It's a different feeling. And how they describe it with the elephant on your chest?
Yeah.
Pretty much true. I mean, it's absolutely debilitating. You cannot walk. I just remember just sitting there going, I got to wait till it passes. And it does pass after a little bit.
Yeah. And that's the thing. It may pass. Don't ever think that you can just walk that off. And sometimes women don't have the elephant on their chest. Sometimes they just have like lower back pain or shoulder pain, and they may have atypical presentation. But anyway, if you're having a heart attack, you absolutely need a stent. That's the only thing that's going to fix that. Okay. But they have to determine that in the hospital, and they have to like do EKG, cardiac enzymes, and then get you into the cath lab. And then they can determine if you need a stent, or maybe it's just like not a blockage that's bad enough to require a stent. And that's what we do in the plant-based world. Sometimes if the blockages are up high, like in like the Widowmaker, the LAD, or like way up high like that, that's a really dangerous spot. But if it's lower, like the right coronary, like Paul had, then we can do lifestyle changes, but you have to get a cardiologist's opinion, okay, to determine which course you need to take. Okay, so I want to be clear about that. But for a lot of people, we can do a dietary approach, and you don't need the stent, but you have to get the cardiologist's opinion to determine whether you need a stent or not, whether this is an acute myocardial infarction. You can't walk that off. Okay, so let's talk about the whole food plant-based diet. And Paul has entire cookbooks and support groups. And yeah, it's a plant-based diet is surprisingly easier to do, I think, than a chicken salmon diet because it's so radically different and you feel so much better. And so when your health radically changes, you're like, oh, I think I'll figure out how to do this, right? So on a plant-based diet, where's this fat level going to go? Remember, this is like a 10% to 30% scale on the fat. Okay. So on the Esselstyn diet, that's a 10% fat diet. So we are automatically going way down to a low fat diet. That's the kind of dietary pattern that promotes health. Okay. Especially if you have heart disease. The fiber is going to be all of a sudden, we are going from hardly any fiber to you're getting like 40 grams a day. Once you start eating legumes on a regular basis and whole grains, and then leafy greens, we do a lot of leafy greens for heart disease reversal. So that's going to be really high. The phytonutrients are going to be very high because leafy greens are full of phytonutrients. Nitric oxide is what repairs those coronary arteries. Okay. Antioxidants, that goes right along with all the good stuff up there. So the antioxidants are going to help put out the fire. When the lining of our coronary arteries gets inflamed, that's what leads to a heart attack. So we want to put the fire out so that you can basically reupholster the lining of your coronary arteries with all these good leafy greens and stuff. Okay, what about TMAO? We have cut out meat and dairy. So guess what? We don't even have TMAO on this pattern, okay? IGF-1, we don't really have zero IGF-1. Even a healthy, perfectly eating person is going to have a small amount of IGF-1 because like if we scrape up our knee and we need to grow, like, or you get a wound, you need to revascularize that area, you do need IGF-1 to stimulate new blood vessel growth, but we don't need high amounts are bad for us and promote cancer. So you're going to have very low levels of IGF-1, and that's where we want our IGF-1. And inflammation, you are not hardly going to have any inflammation. I mean, if you're eating a flawless diet, you won't have any inflammation.
Let me just add to that, just because I want to accentuate that point. The thing that's amazing to me, I'm 65 years old, is that that's one of the biggest reasons why I stay on course, is because I could literally work out every single day and I'm never sore. Like, and I talk to my buddies are in their 60s, 70s, stuff like that. And you hear like, oh, this hurts and that hurts and this. And I don't say a word because I just did 22 miles of bike riding today and I feel great. I could go out again. I go for a night walk. Like to me, that is motivation. That's what keeps me whole and centered is the fact that I love the idea that my body's not telling me, oh, you can't do this today.
Right. And that's what keeps you on the diet because your life just transforms. No one's life is going to radically transform on a chicken salmon diet. You're eating food you don't want to eat anyway. And if anything, things might get 5% better. Right. So, so to be clear, like Dr. Caldwell Esselstyn, Paul's buddy here, did a landmark study. And he did early in the 90s, and then he did a really good one in 2014. He had 177 patients that had all had either a heart attack or a stroke, had a major cardiac event. And he put them on his diet, which is a strict whole food plant-based diet, 6 servings of leafy greens a day, and followed them for 3.5 years. And only one of them had any kind of a coronary event or had a cardiac event. Okay. If we compare this to a Mediterranean diet, they did the same study with a Mediterranean diet. And this is all people that have had a cardiac event. They switched to a Mediterranean diet. Fully 25% of that study group went on to have another cardiac event. Okay. And that's a Mediterranean diet is somewhere between Paul's diet and the whole food plant-based. Like it's a pretty, and a Mediterranean diet has like 73% less coronary events than a standard American diet. Okay. Mediterranean diet's pretty good, but a whole food plant-based diet is 40 times more effective than a Mediterranean diet that was shown in the Lyon study. So a whole food plant-based diet is just life-changing. It will transform your life. And so if you're new to this whole thing and you're wondering, well, how do I learn how to eat a whole food plant-based diet? Well, let me tell you, you need to get the bundle. So in the bundle, that's what this is all about. The people that, if you're watching this video right now, I'm going to guess that you're not like 16 years old, right? Most people that discover whole food plant-based nutrition, they're like Paul, like me, like we discovered because my husband was diagnosed with diabetes. We're middle-aged, you get some kind of chronic disease, and then you have access to the internet and you find out that you can completely change all this with a whole food plant-based diet. So in the bundle, there's all sorts of resources to show you how to switch to a plant-based diet. There's courses like a tofu tutorial, learn how to cook tofu, date paste coupons. Date paste is a whole food plant-based sweetener. They even sell them in stores, or they sell them on the internet at least. I don't like to cook recipe cookbooks. This is from a contributor that's a host with PBNSG along with me. And I mean, I'm a fellow host with PBNSG, but Lauren Bernick wrote a book about people that don't like to cook. These are just things that you can buy off the shelf or frozen vegetables, and you make a perfect plant-based meal out of readily available things. No oil salad dressing ebooks. There's entire courses like on gut health. There's even a how to open a yoga studio course or how to become a yoga instructor. I mean, there are just all sorts of information here. And in my course is really good for people that like this is brand new to them. My first video that's going to be in the bundle is called Where Do You Get Your Protein? And I do a 2-hour live presentation with a whole group of people that are not plant-based. So it's just a fun, non-confrontational thing. And I talk about everything you need to know about the difference between animal protein and plant protein, how much fiber you need every day. And it's also really good for people that are like if you have a spouse that's like, I'm all about plant-based nutrition, but maybe your husband or your wife just is not on board, just have them watch my Where Do You Get Your Protein video only. And that just kind of really spells out the health reasons why a plant-based diet is just life-changing. So yeah, that's basically.
One
go
more
ahead,
thing
Paul.
for you too. At PBNSG, I run a group called Getting It Started. So it's like, where do you begin? Because, I get calls all the time from people who are scared or new to this.
Mm-hmm.
And how do you start? Like, where do you, because I remember how much of, the whole lifestyle change was such a big moment for me because it affected not only me, but everyone I loved. So, I really needed to dive into what is it really going to mean? And, it's still, it still has its moments, but the fact is that health is what you get. And if that's all that really matters. That's really all that matters is your health.
Yeah. And that's a good thing too, like with PBNSG and like through my course too, like there's a lot of people out here that can help you, just like having an opportunity to talk to other people that have been in this situation before. It helps you feel a lot less alone. And I always tell people, like, you may not like to use the internet, you may not like Facebook or whatever, but a lot of people are all by themselves trying to do this plant-based thing, and they don't know anyone that follows a plant-based diet. Well, guess what? It's 2022 and we've got the internet, and you can find also like thousands of people in this community that are all doing this at all different levels of knowledge that can help you. And that's what we want to do. It is so much more fun to reverse chronic disease than to manage chronic disease like I did for 20 years. That's why I love it so much. So yeah, continue to watch. And my social media information and Paul's is going to be in the show notes here. So click below. You can click the link below to purchase the bundle, but then follow me on YouTube and on Facebook all this week. I'm going to be doing interviews with a bunch of other people and just teaching like little bits of knowledge that are going to help you understand more about plant-based nutrition. So yeah, so Paul, I really appreciate you coming on today and sharing your story. I know you're really shy and you don't like to talk, but yeah, I appreciate you for overcoming your stage fright.
Yeah, it's been a lifelong problem. Hey, and it's funny you say that because I used to do this all live and all that, and the only way I could settle myself down was to tell like dad jokes, but it worked. I really, because it's not like I had a lot of experience talking in front of a lot of people, but the important thing is that when I look back, I was very much alone 12 years ago, but today there's just so many connections that you could make. There's so many more cookbooks. There's so much more information. And I would say my challenge to everybody who's looking at me, you could do anything for 14 days, but if you're going to try it, I would recommend two things. One is to get some blood work before and after, just so, you could see that in just 2 weeks, you did a great job and this is the improvements. And then make sure you've got a supporting people. It could be wife, brother, sister, hey, if you got to hire a psychologist, you got to have somebody to talk to about it. You can't do it alone. I was thankful I had my wife, so my point is that this could be done. You don't need to suffer, but you need to do a little bit of work. It just won't happen with a pill.
That's right. That's right. Wise words, if ever were spoken. So yeah, well, folks, I appreciate you tuning in today. Like and subscribe and follow us on social media. And yeah, hang in there. You're going to learn a whole lot this week. So peace, love, and plants. Take care, everyone. Bye-bye.
Bye-bye.